I'm a GP with a background in public health, medical education and the voluntary sector. I have a diverse portfolio career which keeps me really busy, but also which I really enjoy. That's a bit about my professional identity. But of course, I'm more than just my professional identity. I was born in the UK to a mother of Indian heritage and father of Pakistani heritage. When I was 3, we moved to the Middle East. I came back here frequently to visit family and also lived here briefly in the middle, but permanently moved back when I was 16. And although British, I can in some way relate to the experience of new migrants to the UK, especially children. I remember that experience like it was yesterday. I'm also Muslim. This is a part of my identity that became more prominent in my late 20s and early 30s. Despite growing up and living in Saudi Arabia for 8 years, I wasn't particularly religious and neither were my parents. I became more curious and interested when I moved back to the UK, and this was made more acute after September 11, which occurred shortly after I moved back and would come to profoundly shape my personal and professional experiences and how I relate to my Muslim identity. In my career as a Muslim doctor, there have been times where I felt a tension, both internal and external, between my faith and profession. These times have also been helpful to encourage me to look really deep and see the natural complementarity between my various identities and how they work together. My belief in God and core Islamic principles of compassion, justice, integrity, and personal excellence make me a better Muslim and better doctor. Faith can sometimes feel like an unwelcome identity in the healthcare system, which is a shame as it's a huge asset that doesn't fully get utilised to the detriment of the workforce and patients. It's important to understand that when we come to work, we don't just turn up as doctors. We embody multiple identities, roles and attributes. We have intersectional identities and experiences. If healthcare professionals are to flourish and feel valued and supported, they must feel confident and empowered to bring their whole selves to work without fear of being judged or ridiculed or being made to deny or hide parts of themselves. So during this episode, I hope to talk about what being a Muslim means to me, how my faith interacts with my profession, the challenges I've experienced and what I've learned from them, and what support is available to colleagues and students who may relate to some of my experiences. I knew I wanted to be a doctor when I was 8, and I can't exactly pinpoint what it was. I really enjoyed science. I also really liked kind of doing things for other people. That was something that was part of who I was, even when I was a child. And medicine just naturally aligned to my interests. So that's why I decided to do it. There wasn't any particular person. My parents aren't doctors. I have various academics in my family, but not medical doctors. So it wasn't somebody that I saw, or it wasn't kind of forced upon me by my parents. That there's this common stereotype: if you're an Asian child, that your parents want you to be a doctor. That certainly wasn't the case with me. It was something that I decided to do really early on. In its really basic form, being a Muslim to me means living my life in accordance with the values and teachings of Islam. And that means really understanding what those ethical principles are, what the higher objectives of sacred text are. I wasn't very religious when I was growing up, and neither were my parents. But there was a really strong emphasis on morals and values, within our household, being a good person, treating other people kindly. And I was quite a spiritual person, so I was aware of a transcendent, compassionate God, and living my life and understanding that I was living my life with a higher purpose. But when it came to the rituals and the rules, that wasn't something that was particularly practiced in our household, and I became more interested in that later on in life. And actually it was in my late 20s and early 30s that I decided to actually formally study it. So study some of these Islamic sciences that we call, around Islamic law, theology, spirituality, Arabic, and because I wanted to make sense of what it meant to me to be a Muslim, why it was that I was doing things that I do, and other people who call themselves Muslim do the things that they do. So I find myself in a position now where being a Muslim means, practicing my faith with a balance of wisdom and revelation. And obviously values are really important to me. So, how I treat other people, I mentioned about the principles of compassion, justice, mercy, personal excellence. There's a huge emphasis in Islam. So there's a saying of Prophet Muhammad that, he was sent to humanity to perfect character. And also in the Quran, it says, people who have the highest level of faith are those who attain personal excellence and purify their character. So there's a really strong emphasis on character and values. And it's interesting because currently we're seeing in this kind of new age spiritual movement around living the best version of yourself, and these are very, this is very much part of what being a Muslim to me means. I haven't actually felt that, that I've been able to fully express my views or my faith in my journey to become a doctor. So this actually started before I entered medical school. I was, it was a few months after September 11, and I had a medical school interview. And at my interview, I was asked whether if I had to choose a bioterrorism weapon, I would choose anthrax or smallpox. And I was really taken aback by that question. These were people who were meant to be my tutors and educators, people that I would trust and respect and look up to. And I felt that I was being viewed through this prism of violence and security as a 17-year-old. It was a really, really unsettling experience. And for me, that laid the foundation then of how I was to come to express my faith as a medical student. So, I was really conflicted. On the one hand, I was becoming more interested in my religion, and when I moved back to the UK, I was interested in understanding why people around me, in particular one of my friends that I made at school, would go in her lunchtime to pray, behind the chemistry lab, and I would join her, and it was a really beautiful experience. So I was becoming interested in understanding my faith, having not really practiced it for most of my life. And yet this incident happened that shaped the perception of myself and other people like me who were Muslim, and held me back from fully expressing my faith. So when I was at university, I was quite conflicted. I wanted to express my faith, but then I was aware of this stigma that was attached to it as well. I didn't want to be seen as too religious because, would that create any problems? And also I think, that leads to this kind of moral distress, moral dissonance, because you're not entirely sure what you want to do. And, I would go to some of these Islamic society events at university. I didn't particularly felt that I belonged and fitted in. So I felt like I was in kind of a no woman's land almost. I wasn't really religious. I didn't wear a headscarf. I would go out clubbing and all these things. And I felt like, maybe, some of these people who were more religious, more pious were judging me. So, I wouldn't say it was a difficult time, but it was a time of exploration, and I think would then later be the impetus for me to study my faith, to study about my faith in more detail. But what's really interesting is that, although I wasn't particularly engaged with the Islamic society, I did kind of pay that £2 membership fee every year. But a year or two after I left university, I received an email that because I was a member of the Islamic Society, that my details had been passed on to the government and I was on the terror watch list. And I was absolutely flabbergasted. I was like, I have no, I'm not religious. I'm like one of the least religious people that I know. And here I am receiving this email about, about being on the watch list. So, that was quite distressing. And a step before that, I remember when applying for foundation training, I was sitting in the computer lab with a few of my friends who are Muslim, and we were filling out the form, and there was a question, what religion are you? And one of my friends was like, are you going to, what are you going to do? Are you going to write what religion you are? And, one of my other friends was like, no, we can't do that. We can't say that we're Muslim because, we might not get a job. So that fear of being discriminated against was very real because we were acutely aware, as medical students about the way that that people perceived us, and that perhaps we would be discriminated and disadvantaged because of the faith that we belonged to. So, these was how some of the issues played out even before I became a doctor, even before I started medical school. I have to admit, overall, I had a really good experience at medical school. I had a really good group of friends. We were able to talk about these things, and that really helped. So, having a support network is really vital for you to be able to have these conversations, because otherwise, if you don't speak about them and you internalize them, it can be really difficult and distressing to have to deal with, because you're kind of having this almost existential crisis sometimes. So having people to speak to about that was very helpful. I think when I then became a doctor, again, I had kind of peaks and troughs, and with my faith. And it was only, like I said, when I was in my late 20s, I was like, well, let me just find out about this in more detail, find out more formally, instead of having these questions and not really knowing who to go to ask. So, and that was, again, very helpful, because I was then able to study from a range of different sources and scholars, ask questions, and really then start to personalize what my faith meant to me. And I think when I was able to do that, and when I was able to feel confident and comfortable with what being a Muslim means to me, regardless of what other people's expectations and assumptions are, I think that's when I started to find a lot more peace with myself. And I think, much later on, I was in my mid-30s when I started wearing a headscarf, which is quite late for a lot of people. That was on the back of kind of going on a religious pilgrimage called the Hajj, which is a major pilgrimage which Muslims do once in their lifetime. And again, I can't really pinpoint the exact reason why I started wearing a headscarf. It was something that was at the back of my mind for many years, but it was when I came back from the Hajj and I just wasn't able to take it off, essentially. I was wearing it for 3 weeks. It was a really spiritual experience, profoundly moving, and I just felt that I wasn't able to take my headscarf off, and it stayed on ever since. So I remember the first day when I came back, I thought, gosh, what are my colleagues going to think? Up until then, I would come into work really glamorous, my hair down and wearing loads of, wearing jewelry and stuff. And then here I was coming back, with a headscarf on my head. And it was interesting because obviously people saw that I looked different. A lot of colleagues didn't actually comment on it, which I hope, in some way I wish that people had asked me. One of my colleagues did come up to me and was quite interested in what it was that made me take the headscarf. And we would have a lot of conversations around religion and spirituality. He himself was not of a particular faith himself, but was really interested. So we'd have really interesting discussions. There were a couple of comments like, "Oh, why are you wearing that thing? You should show your hair. It's really nice." And that wasn't very helpful. But I think by the point I was taking a headscarf, I had finished my training, and so I was just a lot more confident as a person than if I'd taken it as a junior doctor, which in itself creates a lot of issues in the sense that you feel that you want to fit in, you don't want to look different or feel different from other people. There's a real desire to be like your fellow colleagues and team members, and also. Even when I didn't wear the headscarf, I was quite conservative in the way that I dressed, and I would get the odd comment here and there from colleagues like, "Why do you cover up?" or "Why do you come out for a drink?" and "Why don't you drink alcohol? Isn't your life boring?" So I would get those kind of comments. But when I started wearing the headscarf, I was a qualified GP. I was, quite set in my career, and so and people knew that, and so I think that in general. I wasn't asked these kinds of questions, or, people just kind of kept quiet. But I imagine that if I was a junior doctor in a hospital setting, it would have been very different. I've done quite a bit of research on this actually with Muslim healthcare workers, in particular females, who are visibly and non-visibly Muslim. And a lot of common themes come up. Some of them I can relate to myself, like, being asked questions around why you pray, some colleagues have had some really awful experiences actually around being able to pray at work. one of my friends told me how, she would get bleeped by her registrar all the time. And on one occasion when, she came back to the ward and he asked her where she was, and she said, oh, I just went to pray. And he said, well, doesn't your God know that you have jobs to do? And, lots of other stories around being harassed around wearing a headscarf in theatre, being asked to take it off, being asked to take off that rag on your head, comments like that as well. It can be a really unpleasant experience, especially in specialties like surgery, where I know colleagues and friends who do face challenges, continue to face challenges even now with wearing a headscarf. And the assumptions that are placed upon you as well, that because you choose to do something like wear a headscarf, and which shows that you are committed to your faith. And how can you be committed to a faith or something that is unseen when you're meant to be a scientific doctor, when you're meant to be, rational and intelligent? So in some way, the assumption here is that because you're wearing a headscarf and you're committed to your faith, that you are in some way irrational or intellectually inferior and unscientific and unfit to be a doctor. And that plays out in some of the comments that you can get around your presumed competency or lack of competency around doing your job, and how that makes you feel as part of the team. I know friends and colleagues who don't feel that they belong to the team, and certainly I know when I was a trainee and I chose not to go to the pub, for example, that I missed out on networking opportunities where, projects would be discussed or audits would be discussed, and those are the things that help you progress your career. So in not going to those social events, I knew that in some way I was disadvantaging myself from being open to those career opportunities that would have helped me progress my career much, much quicker. And I know my friends and colleagues have also mentioned the same to me. It's interesting because I've seen a change in perception and attitude in the Muslim community so before I was wearing the headscarf to now that I wear the headscarf. So, when I didn't wear a headscarf, there was an assumption that I'm not committed to my faith, that I'm not a good Muslim. And for example, in the healthcare setting, if I said to colleagues that, I'm going to go and pray, or that I'm fasting, it would be taken as kind of a surprise, because the assumption was that I'm not a practicing Muslim. But when I started wearing the headscarf, all of a sudden, I was seen as somebody who's committed to my faith, a good Muslim, a representative of what a Muslim female should be and should look like. And for me, I find that quite problematic, because when I look at myself maybe 4 or 5 years ago, even a bit longer, my core values haven't changed. I still believe in the same things that I believe in: the importance of honesty, of treating people with kindness and compassion, of having integrity. I believe in all of those things still. And because I choose to wear a headscarf, all of a sudden I'm perceived totally differently. And your faith, my faith certainly, is not about what I wear and what I don't wear. It's much more beyond that. And I think we still have a bit of work to do in the Muslim community around around challenging these assumptions and these narratives that play out between the good Muslim and the bad Muslim. And certainly, again, if I point to the research that I've done with colleagues who wear a headscarf versus who don't wear a headscarf, my colleagues who don't wear a headscarf actually face these challenges where they have these assumptions on the outside about them being ethnic minority and female, and being Muslim, but also within the Muslim community, the challenges that they experience. So you have this kind of outsider status inside the community, because you don't seem to be conforming to what is seen as standards set by whoever they're set by, and so that can be really challenging specifically for Muslims who are not visible, and in particular for women. This can be really challenging for them to navigate, and I fully relate with that because I had those experiences. And then on top of that, you have these assumptions that as a female, you're in some ways not accomplished if you haven't ticked boxes around getting married and having children, because that is a marker of success of a woman. And so we do have pockets of patriarchy within the community, and this is not just an issue that is confined to the Muslim community, because patriarchy is not confined to any culture or faith. But I think within Islamic teachings there are within Islam there are so many teachings around gender equality, and I think a lot of work needs to be done to kind of reach those aspirations and those standards, and to get rid of some of this patriarchal baggage that we're carrying with us, and that plays out to how women in particular are perceived. So this intersection of being female, of being ethnic minority, of being Muslim, and what it means for you in terms of the experiences that you have from people outside the community, but also inside the community. It's a double whammy. It's hard. It can be really challenging, but I think, for me, I think I'm at a point where I'm quite vocal about things anyway. So, and I'm quite open about my views. And I think it's important to do that, and more people need to speak out. I think there's a fear that if you say the wrong thing, that you're going to get stick from it, stick because of it. But I think we need to speak more about it. It can be, like I said, it can be hard to navigate, but it comes back to what I mentioned before. I think when you know your personal values, and when you know the things that are important to you, and when you know in your heart that you're doing the right thing and your intentions are good, it doesn't really matter what other people say and do, because people will always say things. No one will be, happy and celebrating you all the time. I think that's also kind of human nature. So sometimes you just have to let things go, and as long as you're comfortable with what you're doing, and what you believe, then that's fine. Of course, if there's outright kind of misogyny or discrimination or abuse, harassment, etc., then that needs to be challenged, in a different way. So yeah, you need to pick your battles. I mean, I'm not going to play it down. It can be really hard. It can be hard because you're trying your best at work. You're showing up. You're working really hard. You're going above and beyond. And my colleagues know this. I've always done this in all my jobs, where, training and post CCT, where I've always gone above and beyond to be of help to colleagues and also to my patients. And so it feels like you're doing all of this, but in some way, it's not good enough. I think I'm more lucky in the sense that I wasn't visibly Muslim as a trainee, and so some of these challenges were less acute for me. But even so, it can affects you quite deeply, because you're kind of wondering around what's the value of it all. What's the purpose of everything that you're doing? Are you in some way compromised? Do you have to make difficult compromises? Do you compromise your faith because you're not able to pray, or you're struggling with the fact that you don't feel included because you're not going out with your colleagues? Do you compromise on your faith and make those sacrifices? And people will say, and I've experienced this myself as well, you don't want to make those sacrifices, but you're being left behind. So there's this kind of moral distress that you feel, right, in terms of you want to do the right thing, you don't know whether you're doing the right thing, then you start wondering, what is the right thing, So it can really sometimes put you in this dark place where you're just questioning a lot of things. But I think some of those places have been really helpful for me to be able to better understand myself, and to be able to better understand actually what is important to me, what I'm willing to compromise on and what I'm not willing to compromise on, and just make me a lot more confident in my choices. And I think what's also helped me is just understanding, what values are important to me, and how do I live my life in accordance with those values. I think for me that has been the most life-changing thing, if I was to pick out one thing, is understanding those values and things that are important to me, that give me value, that give me meaning and purpose, and everything else doesn't really matter. So what people say about me, what assumptions they make about me, doesn't really matter if I know I'm doing the right thing. Having a support network is really important. My friends and family, having people to talk about these issues and challenges that you experience can be really helpful as well, because sometimes you just need a sense check to make sure that you're not going crazy. So I'm really grateful for the support that I've had. And also, I think one of the biggest kind of sources of support is my faith itself. And people forget that. For a lot of people, especially from ethnic minorities, faith is an integral part of our coping mechanisms and inner resources. And what really annoys me sometimes, actually not sometimes, a lot of the times, and more recently, is that, there's all this talk about burnout in the healthcare profession and, well-being and spirituality that we're hearing, right? And what we see in response is kind of courses on mindfulness or yoga classes, which is great, but let's just remember where these things come from. All of a sudden, it's okay for Tadasana to be called mountain pose and pranayama to be called, breathing exercises, and that's fine because it's been decolonized for a Western audience and it's acceptable and it's a good way of attaining spirituality and looking after our well-being. But at the same time, I'm hearing friends who are struggling to take 5 minutes out to pray at work, so Muslim friends who are struggling to pray, or being told that they can't use a room on the ward that is completely free to pray for 5 minutes, and that they must go 15 minutes each way to the prayer room at the other end of the hospital. And yet at the same time, there are all these like mindfulness pods that are sprouting up. So, we have to be really careful when we talk about well-being and creating a thriving workforce, and be conscious of the fact that actually some of these narratives, some of these initiatives might be excluding people, and how are they then feeding into inequalities in the workforce, and who are we, what message are we sending out about who we include and who we value when we talk about well-being and spirituality. So, we need to be thinking about what spirituality and well-being in the NHS means, and not just go down this decolonized agenda of, Western mindfulness practices and westernized yoga and other forms of ancient spiritual practices, but now, kind of appropriating them, this cultural appropriation that we see, and repackaging them to make them more palatable to a Western audience. There is, a natural kind of, I feel a natural aversion to bringing in faith in the NHS. And I think we have to be really honest about that, because unless we recognise what the issues are, we're not going to be able to do anything to make the situation better. So, I see the NHS as being a place where it's not easy for people of faith to bring their faith into the workplace. And and we also have to be really careful about this term secularism that we use. I'm all for secularism, for celebrating diversity and pluralism. But often I find that in the NHS, when we talk about secularism, that's not what we're talking about. We're talking about atheism. And what I see, frankly, is atheists who are discriminating against people of faith. And it's creating this hostile environment. And I know this from the research that I've done. I know this from my own personal experiences. I have seen social media posts in groups from colleagues mocking and ridiculing people of faith, fellow doctors saying things like, "Oh, why do people believe in fairy tales?" and other derogatory comments. So it is understood that actually it's very difficult for you to bring your faith into the healthcare workplace. So with that in mind, it's difficult to bring it into the consultation, and I wouldn't bring it willingly into consultation, ever. However, I have noticed that since I've started wearing a headscarf, and also I suppose this aligns with the pandemic as well, because it's only a few months before the pandemic that I started wearing a headscarf, I've noticed that patients have been bringing in faith to the consultation. And that could be for a number of reasons. Maybe they see me as a person of faith, and so understand that faith is important to me, and faith is obviously important to them. That's why they bring it into the consultation. Secondly, the pandemic has been a time of a lot of trauma for many communities, and faith is, for many of these communities, is a very important part of their coping mechanism, to give them, a sense of meaning in difficult times. So, so the combination of the two may be why patients come into the consultation and speak about how faith is important to them, when it comes to kind of mental health and well-being. They will tell me how, they've been going to church or the temple, and how various things they've been doing to serve their community is part of their Christian faith, they would say, or their Muslim faith. So I have seen patients actually bringing in their faith in the consultation, but I would not feel comfortable bringing in faith into the consultation, because the NHS is not an environment that facilitates that, which is a shame, because we talk a lot about person-centered holistic care, and yet we're not creating a safe space for people to be able to talk about things that are important to people's well-being. We know that psychosocial and spiritual health and well-being are part of overall health and well-being, but yet we don't really facilitate discussions around that. In particular around, for example, end-of-life care. I did a palliative care clinic once a week for several years in my practice. And I found it difficult to bring up issues around faith, and I would couch them in kind of more non-faith terms, like asking people, well, what is it how do you find purpose in your life, and do you have a bigger purpose? And I wouldn't actually bring in faith, because I think we're conditioned not to bring it into the consultation, and I think that's a shame. It needs to change. Well, I think for starters, this series is a good place to raise awareness of what some of the issues are. So, having conversations, bringing to awareness the issues that people might be experiencing in the healthcare setting. So whether it's me as a Muslim doctor, whether it's somebody else as a Christian doctor, a Sikh or a Hindu doctor, or Jewish doctor, whatever it may be, what are the issues that we're facing? And I think because otherwise people will never know. So talking more about issues around faith, I think would certainly help. And then, I think once we understand what the issues are, then we can do something about it. I have to say I am seeing a change as well. I think the pandemic has been a driver in changing some of those conversations. We're seeing more conversations around faith taking place in the NHS now, which is good. Partly there's also, I think, been spurred on by the inequalities that we've seen during the pandemic. Organisations really looking at diversity and inclusion issues, being aware of what the protected characteristics are, and that religion is one of them. So, it's good that we are seeing a change in the right direction. It's a shame that it's taken a pandemic to do this. Myself and colleagues have been speaking about this for several years. But I'm hopeful that we will be having more of these meaningful conversations that are mature and empathetic, and action-orientated, so that people do feel included when they come into work, and when they're having consultations with patients where we need to do that holistic assessment to be able to offer tailored support, and that there is support available. This is the other thing. We need to be looking at having faith-sensitive healthcare services, such as counselling, or end-of-life care provision, which is culturally and faith-sensitive. So, these are some of the things that I feel we should be working on, and we are seeing some move towards that. So I don't want to say that nothing's happening in that space, because that's not true. So we are seeing small steps, and that's encouraging. My faith is a constant journey of evolution, and as you've said already, it's full of transitions, and I'm sure I'm going to have more transitions, and I'm very open to that. For me, it's about learning from other people, learning from experiences. Things are changing every day. So, and I'm learning new things every day. I'm learning new things about myself every day. I'm learning new things about other people. So I know that there is so much still to learn, and I'm just very early on in that journey. I think I look back and think about how I would have done some things differently. So when I was maybe asked those questions around, well, why'd you cover up, or why didn't you come out for a drink, and isn't your life boring? And I would just laugh it off, and actually I should have challenged it more. So, as a junior doctor, it can be difficult because of the power dynamics between you and your seniors and the rest of the team, and you don't want to rock the boat. But we are now having a lot more conversations around diversity and inclusion, and I think it's important for us to challenge colleagues when they make comments that are unpleasant. And lots of ways of doing that. It doesn't mean you have to have a full-on confrontation. Simply asking questions gently or probing, trying to understand why people might be asking these questions. In the majority of cases, the intent is not malicious, and I think we need to understand that. But I think it's important for us to challenge those assumptions when people make them about us, and I wish I'd done more of that as a trainee. So to anyone who's watching who's a trainee or medical student, please do stand up for yourself, and you have a voice, and please use that, because you might be challenging somebody who might be making these comments and assumptions about lots of different people, and in challenging those assumptions, you're actually doing a service to so many other people. So the support is kind of currently building up. I mean, for example, during the pandemic, for the first time, we saw faith-sensitive counselling for Muslim workers in the NHS, not just healthcare workers, anyone working in the NHS who was Muslim. So, more initiatives like that are required. So, obviously it depends on the nature of what the issues are that you may be experiencing. So, if you are experiencing any kind of discrimination or Islamophobia at work, then there are different channels that you can raise that. I'm more than happy to be contacted, and the Muslim Doctors Association does a lot of work on advocacy around some of these issues around racism, discrimination and Islamophobia in the NHS. And we run these safe spaces as well for people to come and bring their experiences, for us to have that peer support network, to be able to be there for each other, provide a listening ear, but also to be able to take collective action to challenge some of these issues. So we run these safe spaces. There are also helplines, example, through the BMA, which around specifically harassment and abuse. On the Muslim Doctors Association website, there is a list of support that's available. So within the NHS. So if people feel that they may be struggling, then I'd encourage them to look up those resources, to reach out to me as well, to come to some of our safe spaces sessions as well, where we're there to listen to people and to provide support and to provide action-orientated support as well. What's interesting is my journey in medicine has run in parallel with my journey in kind of understanding my faith, both kind of in study and practice. So what that's kind of allowed me to do is to see the natural synergy and the complementarity that runs between the two. So, for example, both medicine and Islam have a very strong focus on values like personal excellence, like compassion. So the two naturally align. Also, for me, as a Muslim, my faith is a very strong source of support and kind of bringing me joy, happiness and meaning in my work, and being grateful for what I'm doing because it's what I wanted to do since I was 8 years old. So I'm really grateful to be able to do that. But also, you know, a lot of my Muslim friends who are not doctors say, well, you're so lucky that you're a doctor, because when you go into work and you're practicing medicine, you're actually in a state of worship, because we are of service to other people, and that is a form that's classified as a form of worship in Islam. So actually, you know, going into work, I am working as a doctor, but I'm also in a constant state of worship. So, you know, being a good doctor actually means being a good Muslim. So bringing in those values of doing your work to the best of your ability, to having integrity, showing up with excellence, you know, being compassionate, serving those who are on the fringes of society, you know, aligns very, very naturally to medicine, but also is a very strong part of my faith. So, you know, so that's how being a better doctor makes me a better Muslim, and vice versa. After watching this episode, I'd be grateful if viewers could think about 3 reflective questions. The first is, what assumptions do you have about visible female Muslims in healthcare? Where do these assumptions come from? Number 2, in discussions and initiatives around diversity and inclusion, how easy is it for your colleagues who belong to a faith group to be able to practice their faith at work? Have you asked them? And number 3, how easy is it for you to have conversations with colleagues around faith, values, beliefs, and identity? How are well-being initiatives in your workplace inclusive of faith?
Thank you for watching this Meaningful Conversations episode. We hope you enjoyed it. If you would like to see more videos in this series, then please like and subscribe to this channel and hit the bell so you can get notified of new videos as they're posted. We look forward to seeing you in the next one.